Esophageal cancer is a serious condition often diagnosed at an advanced stage, making it one of the cancers with the poorest prognosis. Dysphagia, which is difficulty swallowing, is frequently the first clinical sign, but it often appears when the tumor is already well advanced. This type of cancer accounts for approximately 15% of digestive cancers and is strongly associated with risk factors such as alcohol and tobacco use. Unfortunately, esophageal cancer is often diagnosed late because the initial symptoms are vague and non-specific. When esophageal cancer is suspected, an esogastric endoscopy followed by biopsies is essential to confirm the diagnosis. Early treatment remains key to improving survival chances. A combined approach, including surgery and radiochemotherapy, can offer satisfactory results, particularly if the tumor is localized. However, in many cases, patients present too late when therapeutic options are limited. Surgical treatment remains the primary option, especially in early and moderate stages of the disease. Due to delayed diagnosis, advanced patient age, and associated comorbidities, the prognosis remains extremely poor. The 5-year survival rate is generally below 5%. Esophageal cancer is the third most common digestive cancer after colon and stomach cancers. However, its incidence varies considerably according to geographic regions and populations, largely due to exposure to environmental and behavioral risk factors. For example, certain regions such as China, France, and South Africa have a high risk of developing this type of cancer due to diet, smoking, and excessive alcohol consumption. In contrast, regions such as Senegal and Russia show a lower incidence of this cancer, which may be related to different lifestyle habits. The average age of onset of esophageal cancer is generally around 60 years, with increasing risk as age advances. It is therefore more common in older individuals, although younger cases can also be observed, particularly in high-risk populations. There is a slight male predominance, although the incidence among women is steadily increasing. Regarding histological types, squamous cell carcinoma remains the most common type in many high-risk regions, but adenocarcinoma is increasing, particularly in Western countries. Esophageal cancer is closely linked to risk factors that can be exogenous or related to precancerous lesions. Exogenous factors play a major role, particularly lifestyle and environmental factors. Alcohol and tobacco both are independent risk factors for esophageal cancer. Combined consumption significantly multiplies the risk of developing this disease. These substances irritate the esophageal mucosa and increase the likelihood of cellular mutations leading to cancer. The type of food as well as methods of preservation and preparation also influence risk. Consuming very hot food can cause repeated burns and lesions of the esophageal mucosa. Vitamin deficiencies can impair the mucosa's ability to repair itself. Excess nitrates and nitrites found in certain preserved foods are also contributing factors. Exposure to ionizing radiation, contact with heavy metals, chronic esophageal trauma, often due to repeated lesions, and poor oral health, such as inadequate dental hygiene promoting infection and inflammation, also increase the risk. Precancerous lesions. Certain medical conditions often precede the development of esophageal cancer. The endobrachioesophagus, also called Barrett's esophagus, a metaplasia of the esophageal mucosa secondary to chronic gastroesophageal reflux, in which normal esophageal cells transform into a cell type similar to intestinal cells. This transformation increases the risk of cancer. Idiopathic megaesophagus, or achalasia, a disease in which the esophagus loses its ability to properly dilate. Caustic stricture, which are burns of the esophagus caused by ingestion of caustic substances, often chemicals, which can lead to scarring and malignant transformation. Chronic or repeated gastroesophageal reflux can cause chronic esophagitis, with a risk of progressively severe dysplasia. Over time, this may lead to high-grade dysplasia and ultimately cancer. Some conditions are frequently associated with esophageal cancer, particularly other cancers. There is a preferential association between esophageal cancer and cancers of the bronchi or ENT organs, like the nose or throat. This may result from shared exposure to common risk factors, such as smoking and alcohol. These cancers may occur synchronously, meaning simultaneously, or metachronously, meaning developing after a first cancer. Although environmental and behavioral factors play a role, some individuals may have a genetic predisposition to esophageal cancer. A family history of this type of cancer increases the risk, and certain genetic mutations may make the esophageal mucosa more susceptible to damage.